Hello, everyone. Welcome to Symmetry's webinar. We're going to give everybody just a minute to get into the room, get their audio set up. While you all are joining, I'll just go over a few housekeeping items. If you have any questions during the webinar, feel free to put them into the Q&A. As time allows, we'll get to the questions, and if we run out of time for some reason, we will certainly address your questions in a follow-up email. We are very happy that you guys are here today. We've got an exciting webinar for you from two of the best experts in the field. I'm Missy Gilliland, the Learning and Development Director here at Symmetry. If you have any questions, feel free to put them in the chat or in the Q&A. We will answer them as time allows. I will be posting the handout in the chat here in just a moment. So with that, we're very glad you could join us. I'm going to hand it over to Rob to introduce himself and get us started.
Thank you, Missy. Hi, everyone. Thank you for joining us today. Thank you for taking the time. My name is Rob Simeon. I am a principal and SVP of consulting at Symmetry. I oversee our consulting team. My background is I am a CPA and I have a finance background. I've been in the home health and hospice space for the last going on 16 years this year. So excited to be here and talk to you. And I'm going to pass it to my colleague, Tim.
Yeah, good afternoon. Glad you all could join us. Tim Carpenter, I'm the VP of EHR Consulting at Symmetry, and that really encompasses all of our work around EHR selection, optimization, and implementation. I've got a long background in human services, trained as a master's level social worker, worked in a private agency for a number of years, and then a lot of experience kind of on the vendor side and also in consulting now for about the last 8 years. So again, glad you could join us. And, Rob and I want to take the next 30 minutes to really talk with you about EHR optimization, really best practices on how to move forward with that. We'll talk about kind of 4 areas: EHR Gap Analysis, how to do that, then how to look at your opportunities to optimize your existing system. We'll look at the return on investment of optimizing versus selecting a new EHR. Then we'll take just a couple minutes to talk about your ongoing sort of EHR governance and support model, some thoughts around that. So when we have clients reach out to us with problems, challenges with the EHR, they really fall into kind of about 5 themes, I would say 5 buckets that are pretty common. And one is really around overall compliance requirements. And the key pain point we see there quite often is that there's a lot of this that's being managed outside the system. And, one great example of that are around compliance timelines. Every part of our industries have requirements that need to be met, every 90 days or every year, annual reassessments, reevaluations, consents need to be renewed. And a lot of the systems, the clients don't have fully set up, configured properly to help manage that. So they've got it outside on a spreadsheet. So we hear a lot about that, along with clinical documentation that is often not being fully managed in the system either. So to meet that full set of compliance requirements, they're completing some of it in the system, and then they're scanning documents and importing those into the system. Another common area is revenue cycle challenges. It really spans the full cycle of the revenue cycle workflow. From that point of, collecting insurance information where it's applicable, doing the eligibility verification, on through, scheduling, making sure you're scheduling with a paneled provider in the case of outpatient services, the charge capture process, managing authorizations can be a real challenge. And then finally, the kind of implementation of pre-billing edits. So how do we not, focus on managing denied claims and try to get clean claims going out the door? And so how to have the system set up properly to ensure that we're getting information correct before we ever send a claim. Reporting can be a real challenge as well. And reporting across the board from financial reporting around the revenue cycle, not great visibility into AR at times, or the breakdown of denied claims by adjustment code and so forth. but also broader reporting around services. And again, some of the compliance information you're trying to manage. So what we see, a lot of clients are kind of running multiple reports, merging that data together into a common spreadsheet to try to get to where they need to be, and can be a real pain point as well. Inefficient workflows, and I really think about that from the standpoint of the user experience. We have a lot of clients, when we're doing interviews during an assessment, that are reporting just a lot of clicks, a lot of pain points around the use of the system. So a lot of challenges kind of in that category. And then finally, just integrations. Either systems not being integrated, that you haven't pursued an integration of certain tools, or they're just not fully integrated. So we think about that from the standpoint of third-party tools like patient engagement tools, appointment reminders, telehealth, so forth. So really kind of the challenges that we're hearing when people come to us kind of fall into those 5 categories. So our recommended approach for looking at that EHR assessment and optimization just really follows this workflow. Assessing your current state, while at the same time thinking about what your future vision is for where you want to go with your EHR, what you need it to support. Defining your optimization options. Looking at the ROI, again, between optimizing and selecting a new system. Defining that roadmap on how you're going to move forward, and then executing that plan. And most importantly, continuing to kind of run that cycle. You need to continue, you're always in, as much as it's sometimes painful, always in this process of optimizing your system as your organization changes, your payers change, and so forth. So I talked a little bit about that future state vision for the EHR. And that's really important when you're assessing kind of the current EHR, also being looking at, where are you going? What do you need it to do in the future? How do we sort of future-proof the technology that you need for where you're headed as an organization? So our recommendation is that's an exercise that's done mostly with your executive team, your leaders that are creating kind of the services and new developments in the organization as you go forward. What are new services or programs you're planning to launch? What are new payers you need to start to be able to work with? And what are some of the billing requirements they may have that are different that you need to be able to support as you go forward? And back to those integrations that I referenced earlier, telehealth, appointment reminders, and so forth. What does the future look like for you with that? What integrations do you need to be able to plan for and know that your system can accommodate? So important to keep those in mind. And then sort of the bigger picture of where you're going as an organization. Are you going to be growing organically, through those programs and services? Are you going to be actually moving into, whole new kind of regions, or moving into a new state? Are you planning to do mergers and acquisitions where you need to be able to bring on, holding, separate entities into the existing platform? And again, around payment models, do you expect that to be changing in a way that you need to ensure that your future system can really manage the kind of payment models that you're going to be dealing with as you move forward? So things to keep in mind, but most importantly, I would say it's last on my list, but definitely not least, is the staff experience. We're hearing more and more that staff are leaving organizations based on the systems they have to use. And in this time where we're seeing pretty significant workforce crisis across all of the service sectors, how do we ensure we're creating the best user experience for our staff in how they document information and interact with requirements they have to complete? So that's important as you kind of think about the future state of where you're headed. So back to assessing the current state. So you've got that vision defined, you're working with your leadership team on that. It's assessing the current state of the EHR today. So our recommendation is that you do that through some detailed workflow interviews. So workflow interviews across the administrative, support, clinical, and revenue cycle teams of the organization. And these are really detailed conversations. So clinically, it's starting at the point of inquiry or referral, or referral of an individual for services or to your organization, all the way through the intake and registration process, verifying insurance, scheduling for assessments, and through that entire process. And also the same for the revenue cycle. And as you go through that detailed workflow and you're documenting that, inventorying key pain points and challenges in that workflow. Documenting what's not working, including what is working, but documenting those pain points, what's not working well, and being clear about what is not working because of EHR functionality, gaps in the capabilities of the system. What's not working well because of process, which may be related to technology, but it's also people. And also being clear about what's being documented or where are you using external tools, either mandated like payer portals or state portals, or like the spreadsheets that I mentioned earlier. For each of those issues, also rate the business impact of each issue. And partly we're doing that so as you get into optimization, how do you prioritize what you're going to tackle first? So document the business impact. And we're really doing that from a t-shirt size kind of perspective, small, medium, large, or high, high, medium, low business impact. Document the future desired state. So thinking about best practices, whether it's clinically or in the revenue cycle, documenting the future state of where you're trying to go. How do you need each issue to be corrected? And in some cases, it's important to do that in a visual workflow. So where you've got a lot of complexity and a lot of challenge, it's helpful to do that visually as a tool to show your staff and get their feedback and make sure that you got it right, that you're understanding the issues correctly, you're documenting the future desired state correctly. That visual workflow can be powerful. And I'll show you a quick example of that shortly. And then it's important to also assess the staff knowledge of the system. Sometimes we get into this loop of thinking the system isn't working, staff are complaining about it. And what we realize, the system actually is perfectly designed to do what it needs to do, but there's a gap in staff training. They actually, we've new staff that have been onboarded and there's a gap in their understanding. So we want to make sure that we understand the level of staff competency with the workflows that have been designed. Same applies to roles and responsibilities set up in the system. Some of these issues can be permissioning related to their access to certain capabilities in the system. Also important to look at the payer setup for workflow purposes. Is that really optimized in the system? So I talked about a visual workflow. Here's just a quick example of that. I won't go through it in detail, but you get an idea of the level of detail we get into of each step in a process, who's doing it, identifying, as I have here in red, what's not working, and also what that future state should look like. So really encourage that in some of the more complicated scenarios. And then we move on to evaluating options for optimizing the system. So to do this well, you really have to engage a system expert in supporting your analysis. Now, you may have someone that's really strong internally, is tracking all the release notes from the vendor, and they may be a really good source for you. So that's great. A lot of organizations don't have that. So you can either contract with an external consultant that has that experience. It could be the vendor you resource for some of that experience as well. But you want to go through each of those issues that we identified and look at what your optimization opportunities are. Can your most critical issues be addressed effectively? Can 80 to 90% of the remaining issues be addressed with acceptable workflows and optimizations in the system? Can some of the issues be resolved through training or process improvement, like I mentioned before? And similar to kind of identifying the impact of each issue, as we did when we documented in the assessment process, is document the level of effort or true cost, if you can, of optimizing the system for each of those issues. And does that system optimization and the impact, the level of effort, have substantial improvement in the effectiveness of the system? Are you making is that optimization effort going to be a substantial improvement in what you have today? So that's really important. And then again, understanding, the optimization effort and the potential impact that has on productivity for the organization generally. So quickly, just a little example here of how we inventory those issues. We document the issue in detail, the impact, as I mentioned, the level of effort or cost, again, in kind of t-shirt sizing approach. Then a yes, no, does that optimization approach meet the need? And then just documentation of that recommendation. So quick coverage there. I'm going to hand it off to Rob to talk through how we look at the ROI of our options.
Perfect. Great. Thank you, Tim. One of the things, and this is where I put my financial cap on while I go through this process, is we have to analyze what's the best course of action for our organization, right? Once we've gone through the optimization process, we're reviewed and done that assessment piece. Where do we go? Do we decide to continue down the path with this particular EMR or EHR and optimize it, or do we go in and select it, right? So first and foremost, that list of inventory items becomes absolutely critical. One of the things you really want to look at is, like Tim had mentioned, what's the manpower you have to get this done? Are you able to go in there and make these changes? Do you have the people? Do you have the training? Do you have all that content to be able to facilitate that? What does that timeline look like for you? Right? If we're talking about that inventory is quite large with some pretty heavy items to move, that timeline could end up being a year, 2 years, 3 years. We've seen optimizations take that long. So really making sure you understand what the level of effort's going to be on those, and then obviously what you can and can't do based on some of the EHR. On top of that, with those items that you realize, hey, maybe the EHR does not have that capability, you have to reassess what are your long-term goals. I look at it from a standpoint, if I'm an organization and I'm looking to develop a new program, right? And that's on my roadmap to do within the next year or two, right? Because we want to be the first to market with that program, to be able to offer to our referral sources, to be able to gain some traction, or maybe even terms of our relationships with a payer. Well, if the EHR doesn't have the capability to take on that program, or there's going to be several workarounds, or we're going to be potentially out of compliance, those are things that are going to affect the long-term vision of your organization. So does that mean, hey, do we need a bolt-on program for this? Do we want another EHR to work through, or can we evaluate, is there another EHR out there that builds has a capacity for all of our programs? And that's really critical when you're looking at your long-term goals. Don't be kind of short-sighted and say, hey, if I flip a few buttons here and flip the buttons here, maybe that'll fix it, right? Because that's not necessarily the case. There's a long-term vision for your organization. And really, for a lot of healthcare organizations out there, we're being asked to be more and more complex in terms of the services that we offer. Can the optimized EMR meet your most critical requirements, right? If there are significant issues that are affecting, like Tim had mentioned, productivity, or something from a compliance standpoint, that are critical requirements that really leave you susceptible to error, loss in volume, loss in staff, and those things aren't on the EHR's roadmap, or that roadmap is continually being pushed, again, evaluate that. Those are some of the things you want to take a look at. Even the standpoint is, do you have confidence in your vendor, right? There's a lot of things out there. A lot of people can come out there and say, hey, we can do this, we can do that. This is great. I've seen a lot of really good presentations of EHRs. What's their roadmap? What's their defined timeline? Do they consistently push back those timelines? Why do they consistently push back those timelines, right? Those are things you want to evaluate. Also, the support structure. If they're going to go down the route of optimization, what type of support are you going to get from your EHR? Are they available for questions? How quickly do they answer tickets for your team? That customer service component of the EHR, probably one of the most critical components of this. When we look at EHRs and we've looked at market share over the years, the biggest complaint that a lot of agencies have for moving from one EHR to the next is the fact that they're not getting that support for their ground level staff that's asking for it. And again, big thing from an employee satisfaction thing, big thing from an employee retention thing. What are the costs of the staff and time in vendor from a vendor who are potentially doing the optimization, right? You may need to bring in someone to project manage these. You may need to bring someone in, a couple subject matter experts to make these changes. There may be some heavy lifts. Depending on the size and complexity of your organization too, you may have to pilot this out at certain pieces and make modifications along the way. So again, there's several different changes that are going to occur through this process. How much is it going to take your staff away from what they need to do? And how are you going to, really subsidize that fact that the staff might not be doing work using external resources to do some of their work internally, or potentially even helping on the optimization standpoint. Again, it's a long journey on optimization. It's not quick by any means in some cases. Improving growth, staffing ratios, and reimbursement maximization. Right now, I mean, if you're in healthcare, financially, there's a lot of struggles going on at different levels, right? Becoming more and more difficult from a payer requirements to get bills out the door and get dollars collected. You know, our cost to provide care increases, inflation increases, yet our reimbursement doesn't increase, especially if we're predominantly governmental payers, and even some of the non-governmental payers can be very difficult to work with. So if this is something that in the short term can really add value and be able to save cost and potentially increase reimbursement, something you really want to look at investing the time in, whether again, be the optimization or the EHR selection. And then, as I said, really the number one thing is if you find that there's significant risk in compliance issues in governmental payer takebacks, that is something you want to address right away. You should be number one on your list of ROI of optimization. If we're out of compliance, all the great work we do in the field, all the care we provide, all those things, that money gets taken back. And to me, as being a finance director, CFO at various organizations, there's nothing more painful in the world than having to write a check back to the government or back to anyone after I know we provided care to our community. So again, those are some of the things you really want to look at from an ROI standpoint. Then next, from an EHR selection, you know, what we want to first look at is, are there current issues that cannot be improved with the optimization, right? And what are those? So identifying those ones that are, again, not on the roadmap, that are far off, that's really going to take a heavy lift from the EHR team to be able to either fix, change, or even modify on that side. And really, when you're looking at that standpoint, you know, making sure you're completing a high-level cost analysis related to implementing a new HR. There is significant cost in implementing a new HR. And sometimes we think it's easy. We just flip on a switch and our clinicians go on to the next EHR. You know, I've seen organizations where I think they've changed EHRs 4 times in 2 years. That is a very big, heavy burden on your team and your staff from a management standpoint. A couple of things you need to look at when you're looking at cost. Number one, really going through that implementation phase, right? So you're going through that implementation phase. You're going to have to take staff away, potentially build out workflows, look at system capability, go in and do your setup of all your payers, your disciplines, your visits, your charges. Everything needs to be set up in the system, which is really going to be critical, obviously. Number two, you're going to have to go through and do testing. Again, takes time, takes a lot of energy from your team. Also, from a transitioning of an EHR, there's 2 folds to this that are really, really complicated every time you do this. Number one, you have to move the patients to the new EHR, right? You have existing patients that could be on your EHR. You may be rolling some patients on. That takes a lot of work and a lot of manpower to be able to do that, because again, it's, you know, if your patient is, you know, reserting, or if it's going to just be going into the new EHR, that's a upload potentially, or re-identification and checking to make sure all that information is accurate there, because when you get to a new EHR, you want to make sure you're able to actually bill out of that. Lastly, too, from a billing perspective, denials, all those different things, working out of 2 EHRs during that period of time becomes more and more complicated, right? I'm a biller. I'm in maybe insurance verification or authorization. If I have to work out of two systems, I'm trying to learn one, which is brand new to me, and I have to go back and clean up everything in the old. I can't tell you how many organizations I've gone into where it's like, oh, we forgot about the old AR. Oh, we didn't really have anyone there, resources to do that. It's things to think of, because that's costly. So again, you know, I've seen agencies have to write off 50% of that old AR, 60%, 70% in that legacy system. So again, making sure you're understanding the cost, because it may mean that you need to bring in temporary staff. You may need to bring in a vendor or someone else to come in and potentially clean up some of that old AR to make sure that you're getting those collected. Completing a high-level analysis of the critical issues. So again, making sure they're supporting the workflows, and make sure they're supporting, as I said, your future vision. You know, making sure if you're opening up a new program, again, new payer, even if you're looking to go into a new geography. For example, Medicaid is different from state to state, right? So if I'm looking to expand, right? Maybe I'm an organization that's looking to go into new states, merge and acquire organizations. That's on my roadmap, and I'm going into Arizona and I'm in Texas. Well, Arizona's Medicaid is a lot different than Texas's Medicaid. New York Medicaid is a lot different than Massachusetts' Medicaid. There's different requirements, there's different things you have to look at. So again, as you start to have these conversations with the EHR vendors that you're bringing in, do they have customers in those states? How is it doing? Maybe use them as references. Give them a call. Say, hey, I'm looking to go into New York, and New York is an uber complex state from a Medicaid standpoint. I might want to talk to a couple of New York organizations to say, hey, how does it work for you? Does it work? Does it meet your needs? Are you able to bill? Are you able to meet the compliance requirements? Making sure you're using that cost analysis and broad critical issue analysis to inform the potential ROI implementing new systems. So again, making sure you're outlining the cost. There's going to be a drop in productivity of staff. Account for the drop of productivity of staff, right? They may be doing, 3 encounters, 4 visits, 2 visits, whatever they may be doing. Again, expect that that's going to drop over the beginning period of time as you transition to the new system. And communication and interoperability with referral sources. Number one, right? If you go from a system that does a good job and communicates all the information, so you get all the patient information uploaded, you're understanding and knowing, when those referrals are coming over, you want to make sure that part is set up in your system. Intake in any organization, the intake function of taking that patient information, the minute that you lose, really momentum there and the workflows are unstable, you end up losing the confidence in that referral source and you lose volume. It is very hard to make up for that volume, and it takes potentially years to get that relationship back. So again, one of the things you really want to focus on first and foremost, besides obviously the clinical care, is that intake process and making sure there's interoperability and communication with your referral sources. I always say the line, there's no EHR that's perfect out there. So don't try to find the perfect one. There's always gaps in every system, and those are the things you have to look at. And that's why when you're going through and doing the EHR selection, filling out your requirements and prioritizing, what are the high requirements? What are the must-haves? What do you need to have on day one and are critical to your program? And that helps you go through this, because you don't want to, if there's an EHR, they're not going to meet every one of your requirements, or you may need to make modifications to your requirements. But again, if you prioritize them in order of impact for your organization, you'll be able to really make sure you're making the right selection fit for your organization. And again, when you're looking at this process, and even when you're looking at it from a standpoint of going through the selection process, I can't say it enough. There is no perfect EHR out there. They all have gaps. So make sure you're really looking at that. Making sure you're looking at the customer service. Is this a software or the vendor that you're going to struggle to work with? Make sure you have a relationship. You may want to look at the contract. What kind of commitments are they going to make to some of your timelines? Outline those. Make sure that you're outlining their customer support policies. All those things need to be part of the contract negotiation standpoints. The impact is the EHR is having on staff retention. Again, number one, if the complaint from every staff member is that we don't know how to use this EHR, number one, you need to train them. Like Tim said, go back and train them. If that's still not working, then it may be something you really want to look at. And as we said, new HR is just a significant undertaking. Again, it's a burden. It can be a burden on staff. Productivity always decreases. And again, there's always these new costs that pop up too, because you may need to bring in a third-party system, a third-party vendor to help you, all these things, and they add up fairly quickly. So make sure you're really doing your due diligence when you're going through that selection process of all those costs. And last, I know we have only a couple of minutes. One of the things you really want to focus on too after you implement the EHR, and as you go through or if implementing, or if you go through an optimization process, is making sure you have an identified governance team. There's nothing more frustrating than I change the EHR in one place and it impacts somewhere else, right? If we give everyone access to make those changes and there's no change management in place, we're going to struggle in any EHR. It doesn't matter even if there is the world's perfect EHR. Really making sure you have those processes, making sure as part of those processes, you're identifying super users who know their function and know their function well in the system and how any type of change may impact that. And also, if there is a change and it does impact them and they accept that change, how they're going to go back and train their team to be able to execute on that. So again, making sure you have that structured process. And then lastly, too, doing things in pilot phases. I'm not a big fan of the big bang where we just release this and let everyone go. Doesn't typically work well and ends up creating a backlog of problems. So again, really looking at it, potentially doing it more of a pilot phase structure where you're really testing it out with maybe a branch, team, or location of your organization.
Wonderful. Thank you, Rob. We did just include a visual flow chart for you, so you have that information on hand in your handout. If you have any questions or need any additional information, please don't hesitate to reach out. I didn't see any questions coming in the Q&A, but here are Tim and Rob's emails. So please feel free to reach out to them with any questions you have on an EHR. Rob and Tim, great information. Thank you so much for your time and your expertise.
Yeah, thanks for joining us, everyone.
Thank you, everyone. Thank you, Missy.